give one and get one. Now through December 31st, subscribe to Hoof Beats and you'll receive 2 subscriptions for the price of 1. Perfect for holiday gift giving while still having one of your own to enjoy. Visit shop.ustrotting.com to both give and get.
Young racehorses, not just standardbreds, but any kind, can have this inflammatory airway disease, it's called. And this is a condition in which there's excess mucus in the airways. And we think that that can slow the horse down. Here he is in the barn with some kind of bedding, hay, and a closed-in space. So whatever dust gets in the environment when you are bedding the stall or throwing in the hay, all the little particles in there settle down out of the air really slowly. And in some of them, it takes 36 hours to get to the floor. And by then, you've already changed the stall again. So there's a lot of things in the horse's breathing zone that can irritate his airway. And not every horses are not all created equal. So some horses have no problems. But other horses, when they inhale enough of these type of particles, may develop irritation of the lower airway. And we think that extra mucus may come about. That may be one of the reasons. We can approach treatment either by giving drugs systemically, so that means I give them to him orally, and most horses aren't all that excited about eating something that doesn't taste very good, so you have to talk to him about giving them orally. You can give it by an intramuscular injection or a subcutaneous injection or an intravenous injection, and that's all well and good, but it requires, it's an invasive procedure. And most horses will eventually object to these things over time. So as we're usually trying to treat the lungs and the trachea or all the structures that carry air from the nostril all the way back into the horse's lung, and it's a long, the horse's head is big, so air is being humidified as it moves back through his nasal passages, down his trachea, all the way down the trachea, all the way back here to the lungs, and the lungs are sort of in this configuration. So horses have a lot of lung capacity, but it's a long way between here and here. And so surprisingly, little dust particles and very small particles that are, as we call them, respirable, that means they can stay in the air while the horse is breathing, they can actually get all the way down here. And so can some drugs that we can give by inhalation. So the idea is if you're treating by inhalation for a problem in the lungs, you're treating the lungs directly rather than putting the drug in the muscle, waiting for the blood to pick it up, and then take it to the lungs. This product is called an AeroMask, and it is designed specifically for use in horses. It comes in 3 different sizes, and it has a number of different components. You can see it's got this rubber area that fits over the horse's nose, and the idea is that that makes a little bit of a seal. When the horse breathes in, air comes through these valves, so he's not going to suffocate in there. And this thing is the spacer where we can actually put medication. So this is a very versatile piece of equipment. It can be used for inhalation therapy. It can also be used for nebulizing therapy. And there's some potential that it could be used if you were trying to use a dry powder to treat a horse. The idea is that this thing fits fairly securely, and we would probably make this a little tighter to make it fit more securely on his nose so that we have a sort of almost a seal here. Now, it's not bothering him because when he breathes in, air goes in here and comes out here. Now, if you have ever had to use a preparation yourself that had to be inhaled, you probably remember that the doctor said, actuate it or give yourself the medication when you're breathing in. Even when you're trying to treat yourself that way, that's hard. Never mind trying to guess when the horse is going to inhale. So this spacer is designed so that the end will coapt to any atomizer that you could buy at a pharmacy. And that makes it really easy because we can just script out the drug and attach the little atomizer right to this thing, actuate it whenever we want, say 2 or 3 puffs. The medication stays here until the horse breathes in. There's a one-way valve in here. It doesn't go anywhere if the horse exhales, but when he inhales all of that air. And then the medication travels down this long route into the lung. with a horse, you might have to give, say, 10 puffs on the human atomizer. So you would wait for him to breathe in and then put more in, and because a little bit dilution in the air is good rather than so much that sediments out right here. But that's the beauty of the spacer. With this one, you basically coapt this right on the nostril like that, and then actuate and let the horse breathe in. Now this works pretty well, but you have to be really careful that you stay right over the nostril and you don't do that or that, because if you do, you'll lose the medication. And you can also see that there's not a very big chamber here. So you basically have to be careful how you align this with the horse's airway. But this is a much less expensive item. There's a third product. It has a small chamber that coapts over one nostril, but there's a little bit of a chamber, and then a spacer out here. And that one is also less expensive than the mask, but I think quite useful. So you might say, what kind of drugs can I put in there? Well, when you're treating inflammatory airway disease and extra mucus in the airways, there are two things that you're trying to do. You're trying to reduce inflammation, and you're trying to open the airways. So the two types of drugs that we use are drugs that will bronchodilate and drugs that will cause suppression of the inflammation. Now, we'd want to be very sure the horse didn't have an infection, because we don't want to treat, we need to treat an infection if it exists, but most horses with inflammatory airway disease do not have primarily infectious disease. So the drugs that open the airways, the bronchodilators, there are a number of them, and they can be, I usually recommend that you give that one first, because then it opens the air passing tubes, and then after you've given the bronchodilator, you wait about a half an hour for a treatment to take effect, and then you take your corticosteroid and treat the horse. And the corticosteroid, we think, gets better penetration in the lungs if you give the bronchodilator first to open the bronchioles or the air passing tubes. So that's the goal. So we give the bronchodilator first, wait a half an hour, and then give the steroid. When you give corticosteroids through this inhalation route, some of the drug is absorbed, and actually that amount of drug will reduce the function of the horse's own adrenal glands, and the horse will quit making as much corticosteroid as usual, as he normally would. If you take away the therapy, then his adrenal, the adrenal gland will make some more. But so there are systemic effects, and because of that, racing jurisdictions have rules about what drugs you can give.